Hi, it's Dr. Daly. I want to talk about an interesting new program we're going to do here in Remo, starting in Columbia County and then working the kinks out and moving it out to other counties after that. It's called Leave Behind Naloxone. The idea here is that EMS providers really are in the perfect position to treat patients with opioid use disorder and give them more opportunities to make the right choice, to seek help, and most importantly, to survive an overdose. This is going to give you a chance to leave naloxone with a patient who you are concerned has opioid use disorder and is at risk of an overdose. There are a lot of different reasons to do this, but the most simple is that EMS has the perfect opportunity, really in the patient's own environment, to distribute a kit that will give them a chance to survive an overdose. This has been tried in other places before very successfully. And community members are always first on the scene because somebody has to call 911. The less time somebody is hypoxic from an overdose, the more likely they are to survive effectively, and get a chance to get help. And something that's most important from an EMS perspective is that we will interact with people in the field who have opioid use disorder and are at risk of overdose, who we may not have responded because of an overdose. If you're seeing somebody in their home and recognize signs of opioid use disorder, you can then broach the question of whether or not they are using drugs, whether or not they're at risk of overdose, and whether or not they would like an overdose rescue kit. The structure itself is simple. There will be no cost to agencies who are participating. The naloxone will be supplied through the New York State Department of Health Community Naloxone Distribution Program. The packets will be created by Remo and by Albany Med working together. Education is what we're doing right now, and it's being provided by Remo and Albany Med and assisted by Anand Balazar from Valatia. There'll be county coordinators in order to make sure that we're keeping a good eye on opioid use disorder in the counties. And there'll also be agency coordinators to make sure that people are educated in the use of the Leave Behind program. Our goal ultimately is to improve outcomes for our patients, increase awareness of opioid use disorder in our communities, and ultimately to promote access to treatment, other resources to help people who are using drugs to make the best decisions. If you Google Leave Behind Naloxone programs, you're going to find that there's some out there. In fact, there's one in Salt Lake City being done by the Salt Lake City Fire Department and Dr. Jennifer Plum. It's extremely successful. Arizona has a program. The City of Philadelphia and the Commonwealth of Pennsylvania have a successful program. And FDNY is just getting one off the ground in New York City. Things that we need to think about in order to do this. The first is an at-risk person. At-risk person is something that takes any pejorative concerns away from the name of the person we're talking about. This is anybody identified by EMS who is either using narcotics or is at risk of using narcotics, who may be at risk. The Leave Behind Naloxone kits, these are Overdose Response Kits. These kits will have informational packets in them and intranasal Narcan. We'll show you those kits in a minute. And then just-in-time training is exactly what you're going to do. It's what it sounds like. You're going to train people to use the kits that you're leaving behind so they can help in case of an emergency. The most important thing for EMS providers to remember is this is really easy. You're going to do a brief just-in-time training on using the kit. This is to family, friends, and people at risk. They're going to understand the concepts really well because they understand the drugs that their person at risk is using most of the time. You're going to give them the kit. That's really it. It's that simple. Here's what the kit looks like. We'll spend some time in a minute looking at the contents of that kit a little more closely. The three things you're going to do is review the signs and symptoms of an opioid overdose. You're going to encourage use and instructions, and most importantly, you're going to encourage people to call 911. Calling 911 is one of the most important things we can encourage people to do at any time. And in this, it's absolutely life-saving. The signs and symptoms of opioid overdose that you're going to review are the things that we normally think of. You're going to review that people are unconscious or unresponsive, that they're not breathing or they're breathing very shallowly. Talk a little bit about agonal breathing and snoring respirations. Talk about what cyanosis looks like. People with blue lips, nail beds. You can talk about pinpoint pupils, but if somebody knows it's an overdose after someone's shooting drugs and they're not breathing, the pinpoint pupils are just an additional piece of information, but not something that is a game changer. Talk about clammy skin as well and how people really look when they've overdosed. The other thing to talk about is that these symptoms and these signs can be a lot of other things as well as an opioid overdose. And that's part of the reason that it's so important for people to call 911 and not be afraid. If there's any questions about the Good Samaritan law that are raised on the scene, very frequently we'll have a law enforcement officer there who can also spend time talking to people at risk about the Good Samaritan law and calling for help when someone is overdosed. If somebody calls 911 and is exhibiting any of these signs and symptoms, they may very well end up being talked through CPR. That also can be life-saving. The call to 911 is of paramount importance. This is the training that we're suggesting that you do. The first is tell people to call 911. Anytime they suspect an overdose, call 911. See if the person is responsive to painful stimuli. Teach them how to do a sternal rub. Then have them check breathing. We're doing it simply. Breathing is either normal or fast, slow, which is less than 10 times a minute, or no breathing or gasping. By keeping it that simple, we eliminate any other concerns about are they breathing 11 times a minute or 12 times a minute, normal or fast, slow, or not breathing at all. And we encourage the 911 call taker to talk people through CPR in patients who aren't breathing at all. Things to remember about use. First, naloxone blocks the effects of opioids, and it won't hurt somebody that's not taking opioids. You may get that question. We want people to use naloxone right away in somebody who they suspect of having an opioid emergency because that's the best way to help. We want medical help right away. Call 911. And they can give a second dose if appropriate. The instructions are included in every one of these packets as well. And the instructions are simple. Open the box. Place the naloxone applicator in the nose. Press the button. The only thing we encourage is to make sure people don't prime the device. If you prime the device, you lose the naloxone. You can't test it first. It's a one-shot deal. Important pearls, one more time. This only affects people who've taken opioids. Give it right away, even if you're not sure. Call 911. I cannot stress that enough. Encourage people to call 911. You're proving that you're there to help as part of this program. And they can give it again in 2 to 3 minutes if the patient needs it. Ask the person to teach this back to you. Ask them how they would encourage somebody to use this, what they would say about this kit and how it is to be used. That's very helpful because it helps ensure that indeed that training has been effective. Things that you need to know. Because you've taken this training, you're now allowed to distribute naloxone to treat overdose through the Department of Health Community Access Naloxone Program. That's important for you to know. You can work with your agency to assist members of the public in treating overdose and ultimately saving lives. We want to make sure that you record every time that you give an opioid response kit, an overdose response kit, on a PCR. It must be recorded on that PCR because that way we'll know how many have been given out and we can give that concrete information back to the Department of Health in order to continue to support this program. If you're using a program like EMS Charts, please use the drop-down menu to select the name of the medication of naloxone, and then select not applicable or other as the route of administration. We're currently working with EMS Charts to create a route of administration that will be not applicable, Leave Behind Kit. That hasn't yet been implemented, but stand by for that. If you're using a Zoll software system, ESO, IPCR, or any other system, please do record the drug administration as you normally would any other drug and select a mode of administration such as other or not applicable.
Hi, my name is Anand Balasar, Operations Director at Valatia Rescue Squad. I'll be going over the Overdose Response Kit and its contents. I'll have a packet of information that has the recognition of an overdose and how to give that information to the family members on scene. There are also 2 Narcan administration devices along with the medications included in that kit. On the inside of the information packet, you'll see steps for administering the nasal spray. Just please review that with the people on scene. Make sure they do not prime that device as you'll waste the medication. On the back are all the resources available for the person at risk. Ensure that the person that you're giving this to understands who to call, when to call, and the front of the packet is definitely the most important. Tells them how to recognize an overdose, make sure they call 911, and check for responsiveness, and then check for the breathing status of the patient. If they need any more information on the Narcan kits, they could scan this barcode here, or you could scan it on scene so they could see how to use it, and it'll bring you right to a website to give them more information. Thank you.
If you have questions, comments, or concerns, please email the Leave Behind team, and we'll address those for you. Thank you.